We present an arthroscopic technique of internal ACL augmentation with fiber tape suture. For this technique, anterolateral portal serves for revision and anteromedial for instrumentation. After inspection of ruptured ACL and for any concomitant lesions in the joint, the tibial stump of torn ACL is sutured with a loop by the scorpion.
This loop is dragged outside the joint from anteromedial portal. It is practical to leave the loop protruding from the skin, as in the next step one loose end of the suture will be carried out through the loop. Then, by pulling both ends of the loop, we make a knot on the tibial portion of the ACL. With the use of an aiming device, the tibial canal is performed in knee flexion. Through the tibial canal, both loose ends of the tibial portion tape are dragged outside the joint. A femoral tunnel is drilled with any aiming device for ACL reconstruction.
With a flexed knee, guide wire with loop is carried out through femoral canal from the AM portal. The loop is then dragged from tibial canal and should exit the joint through the tibial canal.
Then the endobutton is armed. For clearer visualization, we will discuss the process on instructional animation. On the 4-hold endobutton, the middle two are stringed with loop for the button tensioning. Into both lateral holes, loose ends of the tibial stump tape are stringed from downside to upside. Medial and lateral directional sutures are placed on the remaining external holes on both sides. The medial directional tape is flipped on the lateral side. And then both directional tapes are dragged through tibial and femoral canals with the help of femoral canal loop. By pulling medial and lateral directional tapes, the endobutton is placed over the femoral canal hole on the cortical bone. The tibial portion of torn ACL is approximated to femoral by pulling tibial ACL tape. After successful approximation, both tapes exiting tibial canal are tensioned and knotted on tibial button. The augmented ACL is then inspected for stability, and if it is satisfying, the instrumentation can be pulled out from the joint and wound closed. We would like to thank you for your time and attention.